got a motorcycle, RTC, 2 people involved.
What I'd like to do, primary survey, and let's get monitoring on.
Everybody ready? Let's do this.
One of the intensive care doctors.
Never seen so many medical people in my life.
What if you inject?
He was attacked, so repeated blows to the head.
We'll get you sorted, all right, Tiger?
We have to realign his spine tonight.
I'd guillotine amputation that today.
If you got any holy water, now is the time.
I'll see you for you.
You're not going to die, don't worry. But if we let go, you might.
You're very safe, it's okay. It's been a long night, babes. It's really hard to explain what it's like to work in an emergency department. You could be holding someone's hand while they take their last breath, and then the next room over is someone who is swearing at you, but you then have to switch without even thinking about your emotions because you're there for those patients. It's chaotic, but also incredible. Hello, ED, Bex speaking. You okay? Do you need any more support? Yeah.
Becky is one of more than 130 nurses, doctors and support staff on shift in Southmead Hospital's emergency department.
No one can prepare you for each shift. You have to be in it, you have to be thrown into the deep end to be able to see if you sink or float.
So this is Richard, the 50-year-old male. He's been climbing up the side of a shipping container, which has been on the back of a lorry. The ladder's snapped. He's come down onto his right leg. You do have an open tilt rib fracture. Other than that, fit him independent.
Thank you very much. Primary survey, please, John, and can we get some monitoring on? My role as trauma team leader is a conductor of an orchestra. There's a lot of coordination. Cassie, do you want to do a primary survey? You're looking at your resus room. What needs to happen?
I'm just going to pop another cannula in and take some blood from you. Is that okay?
And when the trauma phone goes off, you've got to be prepared for the next patient to come in. Rich, you've broken your leg. You know that, don't you? Ultimately, you are going to need an operation to fix it.
But don't worry, we'll look after you.
Hello, it's Jamie speaking.
Hello. Hi, mate. I'll keep this brief. We've got a motorcycle, RTC, 2 people involved. P1, 26-year-old male. Gotcha. He's a front cyclist. Got high lumbar tenderness, paralysis left lower leg. He is tachycardic, expensive, pale, clammy, receiving blood transfusion. Patient 2.
Yeah.
Got an 18-year-old male.
Yes.
Abdominal tenderness, pelvic tenderness. He has got a right lower leg, just a lack.
18-year-old male, upright lower limb, lack.
Yeah, correct, yeah. We're on our way down to you.
Understand. OK, we will see you at 18:30. Safe travels. Bye. Emily, we've got double trauma coming in. That will be here in about just shy of half an hour.
Okay.
Going to put out a trauma call probably in about 10 minutes. Going to get our stuff in order. There can be a game of Jenga, especially when you have multiple patients arriving.
Sorry, sweetheart, I'm just going to move you, OK?
like to make sure that we've got ventilators in both, Belmonts in both, and CMAX in both. Hello, is that the theatre coordinator? I've just received a heads up from HEMS that there is a double motorcycle RTC that may need to come your way.
I've heard a rumour about 2 traumas.
Yes. What I'd like you and Emily to do is to take this one, and I'll take the more severely injured one.
With the helicopter 15 minutes out, Jamie needs to assemble the general trauma team.
Switchboard emergency. ETA 15 minutes. Okay, thank you. Adult trauma team to the emergency department. ETA 10 minutes.
From across the hospital, a team of 15 trauma specialists gathers in Resus.
So, who have we... Good afternoon, I'm Jamie, TTL. Who have we got here, if we don't mind? So, Annie and Zara from ITU. Fine, OK. Third on and second on. General Surgeon, hello. So, there are 2 individuals that have been involved in a motorcyclist RTC. The first patient coming in, which is the sickest patient, is a 26-year-old male who is physiologically shocked and is getting blood products as we speak. The second patient is an 18-year-old male. They were less concerned, but the update I've had from them is that they are now more concerned about him. I'm going to be TTL for this one. Emily and Josh will be next door. Cassie, do you want to do primary survey when we first get in here? Get him through CT safely, quickly, OK? And then make decision-making from there. Right, team, if we can get him over.
Lovely. All right, guys. So I've got Luke. This is 26. They were riding a motorbike. He was the front drop rider, and they came out of a car coming up with a Lidl, hit about 50 miles an hour to the side of it. He was always conscious at the scene, always alert, but reporting a lot of pain, particularly around his chest and back. He's got some upper lumbar tenderness, accompanied with, on his right side, he's got loss of sensation, but a little bit of movement and tone. On the left side, you have no movement and loss of sensation. Both of those seem to localise below the knee, pretty much. Obviously, we're just being very cautious with the spine. That's been the priority initially before we have a bit more of a sort of dynamic collapse on the way in.
Amazing. Thank you very much, Andy. Team, what I'd like to do, primary survey, and let's get monitoring on. It's the big stuff initially that we're looking for. Is my patient safe? Are we deteriorating? I want to work out where the injury burden is.
Right. A gas syringe, please. Is there one in here?
I'm keeping an eye on what their blood pressure is, what their heart rate is, and noting any changes. You're looking for things that are going to make the patient more unstable over time.
Equal air entry.
OK.
I'm one of the more junior members of the team.
Come down, look at the pelvis.
It's a bit nerve-wracking the first few times you do it. It's a lot of responsibility. No bruising in the groin.
OK,
small
fine.
abrasion to his hip, right hip.
GCS-wise at the top, happy, 15?
Yeah.
OK, moving all 4 limbs.
Are you able to wriggle your fingers and toes?
Upper limbs, yes. Down. Not really doing much. Should we start moving, people? OK.
love. What's brought you in to see us today?
I hurt my wrist.
I'll be honest with you now that our wait time, currently some people have been waiting hours to be seen.
She's just asking whether if she can actually be given a bed to lie on. She's in a very uncomfortable position.
I wouldn't have a bed to put her on. It's completely for Mercury and ambulances, so I have nowhere to put her, I'm afraid of it. Sorry.
Okay, Hayley. Joel, lovely, wonderful.
Just over an hour into her shift, and Becky has more patients arriving in the emergency department than she has room for.
You can't stop those patients from coming in. If I have a full resus, a full majors, a full ambulance bay, then where are those patients going to go? It's challenging and it's stressful.
To relieve the pressure, Becky needs to free up some beds urgently.
John, I'm going to open up a cohort.
Yeah.
So, I have highlighted majors 11 to go into vending cohort.
Yeah.
Her only option, move patients into the corridors.
Knock, knock. Hello. My name's Becky. I'm the nurse in charge of the department this evening. I think we were moving you to another area of the department. Sorry that it's a bit rubbish. We don't want to nurse patients in corridors. We don't want to treat patients in corridors. It's heartbreaking. How would you feel about sitting in a chair?
The thing is I don't want to be in a chair.
Yeah. I'm going to keep you here. I think if you're then going to really struggle to sit in a chair, I don't think that's appropriate for you.
Well, I can't for sit down. I have problems as well in sit
Yeah, no, that's fine. I'm just going to move you. Okay, you stay there.
By freeing up beds, Becky can start admitting patients from the queuing ambulances. One of them has been waiting outside with a severe head injury.
Yes. Sounds like a actress, doesn't it? Right.
Is it your own horse you were riding?
Yeah.
Yes, do you just have the one?
I have 3.
Oh! Jealous.
This is my main competition horse. Got a field injury and he went from peak fitness to then being stuck in a stable, and this was day 3 and he had enough.
He's very excited?
Yeah, and he was like, I'm off.
Is that feeling okay?
Yeah.
Yes, I tried leasing a horse once. It's just, it was so far away, and with this job, kind of like when you get the rare moments to enjoy not waking up to an alarm.
Yeah.
So, no allergies, and you had some Oromorph in the ambulance.
Yeah.
Stay nice and still, because I haven't secured it yet, okay?
Okay.
But that's all fine. Did you get any pain when I was flushing it?
Yeah.
I'm going to run your bloods, okay? Sorry.
We do have some incredibly challenging situations here. People ask what the wait's like. Obviously, we can't give a definitive answer to that. It is difficult.
I'm sorry. I hope you're not going to be waiting too long.
As the second patient from the motorbike accident arrives, he's met by another trauma team.
So we're putting an 18-year-old male, Kieran. He's the second casualty in this, on the back of the bike. Injuries, he's got a possible jaw fracture, bleeding from his left ear. He's got no known chest injury, possible right shoulder fracture. He's got a right leg soft tissue injury.
Hi Kieran, my name's Emily. I'm one of the other doctors. I'm just gonna have a quick look at you, okay? All right. Just gonna have a little feel of your neck. Is that painful? Your arm, not your chest. Okay. Chest is all right. Kieran, is it painful in your tummy?
Yeah.
There? Right-sided abdominal tenderness. We've got no long bone injuries. We've got evidence of potentially an open fracture of the right ankle.
Something under here as well.
And, okay, and a nasty injury to the right leg. So orthopedics are now in here, which is really helpful. Sorry, mate. That's just another one of those cannulas, okay?
How's Luke doing? Is he okay?
I'm not sure. There's another team with him at the moment, and I haven't had a chat to them yet, but I will find out for you, okay? Who is Luke to you? Is he mate?
He's one of our best mates.
Yeah, okay. He's having a CT scan at the moment, so we'll know a bit more soon.
Okay, if we get the doors shut.
Injection starting now.
CT is the quickest way to get the most information. It produces 3D images pretty much instantly. Bone is bright white. Hair is black. Soft tissue sort of a grey. And then each specialist will have a look and say, this is what we think we should do. It can be the difference between getting better very quickly and not, you know.
We've spiked the blood and FFP, haven't we? It is a team sport. You have got specialists. You draw on their expertise. Yes. Ultimately, the final decision is down to me as the trauma team leader as to what the patient needs.
So we'd be a bit worried about his aorta at this rate.
Nice breaths.
No significant hemopneumothorax looking at that. So grotty contusions on that side. Christ, that's quite marked contusion early on.
There's a big step here.
Christ.
So his spine is going down here, and then suddenly it goes up here.
Yeah.
We will wait to see the formal report, but realistically, spine has gone.
It could all be a spinal spine.
The CT scan shows 2 vertebrae are severely fractured and dislocated, which is likely to be damaging the nerves and causing the paralysis.
Happy for us to get him out? Perfect, thank you so much. Amazing. Let's get him off, let's get him back. Looking at it, spine. Yeah. It's kind of how it's looking at that.
Just come to get rid of your toilet.
Sorry.
So, oh, don't apologise. It's human nature. We all need to go, don't we?
Since being admitted from the queuing ambulance, Blythe is still waiting to be assessed by a doctor.
Hey, Matt. Young girl has been kicked in her face by a horse.
Hey, that's something now.
Yes, she's quite uncomfortable. Blythe, this is Matt, one of our lovely doctors here at Consultants. Sorry, he's just going to have a chat with you before we prescribe any pain relief. Okay?
Quite a big cut, isn't it?
How's it feeling here where my thumb is?
That's okay.
Not sore?
No.
Can you see my finger?
Uh-huh.
Can you follow it with your eyes? Any pain in your eyes?
No.
No? He didn't kick you anywhere else? This cut will need a couple of stitches. And remember the stitches, the point of them is to reduce the scar from being a big round scar like that to being a flat scar. It can still leave a little scar.
I've got scars. Teeth are all.
And if you put your teeth together, do they feel normal to you or do they feel like they've shifted?
Yeah.
They feel like they've shifted.
I not.
But I think the important bit here is that you feel like your teeth have really shifted.
Yeah.
So we're just going to scan and make sure, okay?
Yeah.
I'm going to ask you not to have anything to eat or drink just until we have the scan and know what we're doing, okay?
Right.
So Reece Huswan is the gentleman that's just coming out of the scanner. He was the 26-year-old that Andy was concerned about.
Yeah.
He's got lumbar spine obvious disruption.
Okay.
He's got a hematoma but no active bleeding into that. In summary, I think this is someone that has a spinal injury.
So we need to speak to neurosurgeons urgently about that. Wow. All right. So that's really serious injury.
With trauma team leader Jamie's shift ending, the first job for his replacement is to find a surgeon to assess the damage to Luke's spine.
Hello, James Cameron. I'm trauma team leader on today.
Yeah.
So we've got a trauma patient.
Okay.
He's got no sensation or movement below the knees, and we haven't tried to move at the hips. You should be able to see on the scan. He hit a car, the sort of side of a car at pace.
Yeah, wow. Complete dislocation of L3 on L4. And the chord equina is going to be cut off by that dislocation. It's been sort of sheared through. We have to realign his spine tonight to give the nerves the best chance of recovery.
Yep.
And ask theatres to kind of allow us in ASAP.
Lovely. All right, cheers. Perfect. Luke, I think there's some of your family are here. Shall I give them an update? Yeah. Yeah, great. It's incredibly difficult for families. It's the worst day of their life, facing that conversation. Sometimes you have to do it in steps and give them time to process what you said. It can be pretty overwhelming. Hello. So I'm James Cameron, I'm one of the doctors. So he's just with the other doctors at the minute. He's awake. And in a bit, he's probably going to go to the operating theatre for an operation. At the moment, his legs are numb, but we don't know whether the extent of that injury until, you know, days and days.
He can't feel his legs.
He's not really feeling his legs. It's a bit mixed.
Is he in any pain?
He's not really uncomfortable. He just looks a bit pale and rubbish, but we're just sort of readying him up to go upstairs. Yeah.
Right, he's going to go upstairs to theatre now, all right? Right, yeah, might be a little bit of a bump when we go in the lift.
Hello, this is Josh, one of the doctors. He's okay, so don't worry too much. He's stable and unconscious. But I think it's probably best that we have a chat in person. Are you in a... Through to the family room and we'll come and have a chat to you. Is that all right? Yeah, no problem. Okay, perfect. I will see you when you get here. My name's Josh, so just ask for me and I'll come and have a chat to you, okay? No problem, no problem. All right, see you soon, bye. They're gonna come in.
Oh, my ankle.
How's that?
Perfect.
Are you still feeling lightheaded, or you've
A little bit.
Okay, is it a bit better now?
We're just putting a dressing on the gun very short.
Sorry, it's so sore. We'll get you some pain relief.
How's Luke
And I'll
doing
try-
as well, do you know?
I don't know at the moment. He's upstairs in theatre, so we will give you an update when we know. Okay?
Thank you.
But nothing's changed since the last time I spoke to you, as far as I'm concerned.
How's your feeling, Joe?
The crew weren't very clear on what happened, but he's just told me he was on the back of the motorbike.
So I heard the handover
Which
from
is
the
what
other one.
the other crew said.
Yeah.
So,
It was the same bike, 50 miles an hour into a car, I think.
Hi, Natalia. Can you consent him?
Okay, thank you. Bye-bye.
Right. A few more people in here. I'm just going to go.
That's it, that's it.
That's it, yeah. Take some.
Neurosurgical register?
Yes.
Comfortable? Any pain when I'm touching? Can you feel me touching? My view is that if someone comes with a severe spinal injury, you need to be honest. I think similar to how I would like to be treated. I would like to know. The sooner I know, the better I'm prepared mentally. What happened, your scan shows that you have multiple spinal fractures, and lower down at L3, L4 looks much worse compared to the higher up.
Worse than it's not fractured break or worse?
It's completely fractured.
That's break, that's what
And it's pushing on your nerves there, and this is the reason why. Yes. And this is the reason why we rush to get you to theater to give you the best chances for recovery. We don't know how will be the recovery. It will be a long recovery.
I'm not going to be riding my bike for a while, I'm not.
Okay, step by step. For the moment, I will complete the consent form to sign the surgery. We need to focus to fix the fracture because it's very bad, the lumbar area. The reason why we do, as I said, is to fix it, to stabilize, and to give you the best chances for recovery. And also for you to be able to sit in the chair to engage with the rehabilitation. Unfortunately, because you have a complete injury, there may be chances that there will not be recovery in your legs in the future. I'm trying to comfort them as much as I can, and I'm trying to keep them positive. Yeah.
With Luke about to undergo surgery, his mum visits Kieran as he waits for his family to arrive.
You all right?
Yeah,
You've got all
I'm
your-
not too bad.
What have they said about you?
They said that they think I've broken my ankle, done something to my shoulder, and what was it? I've broken my jaw.
Broken your jaw? Is that the helmet? Okay.
But apart from that, it's not too bad.
Well, it's bad enough. He's got a fracture. He's got a break in his back, so they're having to pin his back. But at the moment, he's paralysed from the waist down. He can't feel his legs. So don't worry about that. So let's worry about you right now. We have to get you right. I'll worry about him, and I'll keep you posted as much as I possibly can.
Can I give you a
No, because it hurts. Yeah, but you can give me a mini hug.
Thank you.
And if I can do anything for you, I'll get you a drink or whatever you want. Just let me know, all right? Or ask the team here to let me know. I don't think you're allowed anything yet until you've had your treatment.
No, I don't think.
But I can, after you've had your treatment, I can get you a drink or something. I'll
Thank you.
But I'm next door if you need anything.
Cheers. Thank you.
So, Neil Lapardia, spine surgeon.
Natalia Nistочка, register.
Vimal Scrub.
Yes.
Roger Nistris.
That's it.
Mike ODP.
Kate, anaesthetic consultant. Rhiannon, anaesthetic registrar.
This is Luke, a 26-year-old male, RTC. Main injuries are a fracture of his spine at L3-4 and a fractured pelvis, which is stable. The plan is we'll put screws into L2, L3, L4 and L5. And then do we have the all the sort of deformity sets, so the reduction towers, the big sort of rod holders?
Yeah.
Okay.
Spinal surgeon Neil needs to realign Luke's spine to stop it pressing against the nerves.
Have you got a swab, Vimal?
But the longer he takes, the more damage could be done.
Kate, you happy for us to start? Thanks. Okay, starting.
He accesses the spine through Luke's back.
Yeah.
Yes. My focus is on first incising the skin, going down onto the lower muscle layers. As those muscle layers are moved out of the way, I can then see the spine.
So that'll be where we get our entry points.
You don't always know what you're going to find.
Francis process here.
The theatre's a big team, and I'm one of many. Everyone has a role to play.
If you just pack a swab in there.
As he reaches the fractured vertebrae, Neil can see some of the damaged nerves.
So there's the 4 and 5. Unfortunately, all that there is completely shredded. The nerve roots are, well, they all seem to be torn. For the most part, it looks pretty bad for him.
What's brought you in today?
I have an injury in my knee, and it's off and on been bad, and it's suddenly got really bad.
Hello, yes, me.
I've hurt my arm.
If you take a seat, I'll go and write you on the board for them to do the wound care, and then hopefully we can get you home. But I'm not sure what time it would be that you get seen.
I might get Laura to pop out and just help you wash the queue.
She's coming.
Oh, wonderful.
Becky is 2.5 hours into her shift, and the number of patients in the department is still rising.
Hello, lovely. Oh wait, you got your head up as well.
Yeah, they said they're gonna have stitches.
Have they said anything else, like I noticed, like your jaw?
It was this side of my face that took the brunt of it, because this tooth feels like pretty much like it's gone.
I think they're still all there. Still a pretty smile.
I don't mind. It's stressful.
I can hear you, look.
To get back to the horses.
Horses will be okay, Dan. Oh, it's so sweet, I know that. They're all going to be fine now.
Do you think I was born yesterday? Really? Good answer. Hand it over. Guys, you can't drink beer in here. Come on, you kidding me?
While Blythe waits for her scan, in the bay next to her, a visitor is becoming disruptive.
Have you got more in that bag? Curtain's staying open. Someone do something with that.
So this guy, I
Guys,
don't know.
one more time.
It's him?
One more time. We can't tolerate that, okay?
I just happened I think this hospital has helped me out very well.
Thank you.
You get my knee sorted out.
If I see that happening one more time, you'll be asked to leave.
We are here to protect everybody. Patients, staff. I'm from West Africa. The healthcare is not good. Here, many people, they don't know what they have. People are very lucky here. You come in the hospital, discipline. Gentlemen, can you come with us, please? Please.
Hello, this is John, this is Chloe, this is my dad.
Thanks for messaging me, buddy.
Sorry to meet under
That's all right.
circumstances.
What happened then?
I was on the back of my mate's bike, Uber took, and someone pulled out in front of us, and we fucked up.
I know.
I came
your
up-
life 360 gave you away.
For fuck's sake.
So your phone gave you away big time. Good job I put that 360 on there, otherwise I wouldn't have known.
Yeah.
If you've managed to do that and only break your jaw, you're a very lucky boy.
Oh, don't worry, I'm well aware.
Hello.
Hello.
You had me worried sick.
I fucked it a little bit. Show the wound on my leg.
You can't, he's covered up again.
Oh, bastard.
He's got a muscle deep wound on his leg, and that's about it, and possibly a broken jaw.
Kieran,
Yeah.
I'm so glad you're okay, but please don't ever do that to me again, okay?
I'll try. I can't really smile properly, it looks a bit fucking cack-handed.
I hope this makes you have a bit of sense.
A little bit. Tiny bit.
A little bit?
Tiny bit. I'm still getting back on the bike.
I have no doubt you'll get back on a bike, but could you just be a bit careful?
I wasn't riding.
Ride a little bit slower.
I wasn't riding. I was on the back.
I know you wasn't riding today, but I know how you ride.
Yeah,
okay?
true.
And the feeling that I've had today.
I'll message you.
Alright, right, Kieran.
Love you. Bye.
I love you.
Love you too.
Be careful, okay?
I will.
See you in a bit.
No, I'll take this first. Thank you.
One hour into Luke's operation, and the surgery team has removed shards of bone, which may have caused some of the nerve damage.
Okay, do you mind coming in for a picture, please?
Now they can start to realign the spine.
Between here and here, just so these sort of...
They'll begin by fixing the fractured vertebrae back into position using metal rods and screws.
Okay, can you see that? Okay.
Yeah.
Between here and here, just so these sort of... Do it slowly.
A radiographer is called in to provide x-rays, helping Neil to fix screws into an area that's just 7 millimeters wide in places.
So if you think of that as like an owl's face, we've got a beak, two eyes. It's those eyes which we're going to place our screws in. And the idea is to go there, 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 and there, above where this fracture dislocation is. And then we'll do the same thing below. A mallet, please.
There is a balance between being delicate, but also exerting force when putting the screws in. It's very finite and delicate. Okay, can I have another 6.5 by 45? Yeah. There isn't much margin for error. Take a shot there. So that's now the top block done. Those are the screws that have gone down the column of bone called the pedicle. We saw the owl's eyes that we were looking at before. And those are our fixation into the spine. So now we're going to repeat that on the block below. That's now our second block of screws at the bottom.
The 8 screws will now be attached to metal rods to align the spine and hold it in place.
Go on, yeah, well done. One more? Excellent. So let's put these in.
Once that's done, the team will have a clearer view of the damage to the nerves and will see how likely it is that Luke could be permanently paralysed.
Okay, now the hard work begins.
Hello.
Hiya.
How are we doing?
Good, you okay?
Yeah, not too bad.
Very nice to meet you. Not under the greatest of
No.
circumstances, but I'm Mum, Louise. This is
Steve.
Hi. I'm Danielle.
Steve.
Sister.
How's he getting on?
He's not great, to be honest. We're just waiting for the results of surgery. So he's, at the moment, paralysed waist down.
Right.
We're just trying to fix that.
Stabilise it at the minute.
Stabilise it.
3 to 4 hour surgery, so we are expecting 1, maybe half 1. And I think we're being a little bit generous there, if I'm being honest.
Luke, as a little boy, was always the joker. He loved anything with wheels, whether that be cars, bikes, tractors, you name it, he loved it. His passion for motorbikes, I would say, started when he was around 10 years old. The noise, the speed, he loved the freedom. I always had fears about Luke being on a bike. They're just so exposed. It's terrifying, but you have to try and push that to the back of your mind when you know that he wants to do this. It's his decision.
It's going to be a long recovery.
Yeah.
Long road to recovery for both of them. They're both going to end up having a bit of a long recovery.
What's Kieran's injury?
So, fractured jaw, pelvis, and a couple of other flesh wounds. I think they've been pretty inseparable recently, haven't they?
Yeah. Not the way to learn a lesson, though, is it? Hey?
Well, unfortunately, they're boys. Boys will be boys. Boys will do daft things.
Things like this really put everything into perspective,
Oh, yeah.
and I do hope that they have now learnt their lesson.
It's just a waiting game now. It's the longest 4 hours of my life, I think.
Gentlemen, can you come with us, please?
This isn't funny.
You said
if you
no.
refuse, they will escort you off the premises, and if we need to, we'll phone the police. We're not joking. In your best interest.
Are you okay? What's the matter?
He's been seen drinking again. Asked him to leave.
Right. So you can see how incredibly busy we are. You have taken away 3 senior members of staff, 3 security officers. You are you have been given a verbal warning. You have continued to drink on hospital premises. You are now taken away from sick patients. Okay, you're now being obstructive. You have been drinking, and that is not appropriate. You have then been verbally abusive to staff. That is also unacceptable and actually is a criminal offence. So I'm going to ask you again to leave. You can carry on rolling your cigarette outside and off hospital premises. Okay, I will. All right? I will. Yep, I'm going to go and speak to them. Thank you very much. Hello. Can I just chat to you? My name's Becky. I'm the nurse in charge of the department. We have a gentleman who is refusing to leave. He's now been incredibly abusive to staff. He is a relative and he's been drinking on hospital premises. I don't know whether just a face would be able to help or whether you were able to ring someone. I'm happy to ring 999 for assistance.
I can radio through and see if we've got another unit. We've got to
You're
stay
about
on
to go. Yeah, no, I completely
yeah,
understand, and I know it's a big ask, but
Whereabouts is he?
he's just in our crossroads area by the ambulances.
patient?
You know, he's a relative.
Okay.
Please. Just to give you the situation of our department, it is incredibly full. There are over 120 patients in the department with over 10 ambulances outside. He is now obstructing our department and taking away vital sources of all 3 nursing charges and security officers.
Come on, just go.
Is it on my back then, bud? Yeah, that's your back.
Security are trying to remove him. He is now resisting. There is probably about 50 patients in the department.
Don't do that. Let's go.
Do you want to just pop that on your pipe like that? I know, I understand that, lovely. That's it, well done. All righty. It's okay, don't worry, it's fine. Hi, Laura, you okay? Just dealing with a situation out in the front and I've just called the police. It's just really crappy.
Do you need any support out there?
I don't. What I need is bed moves, which you are working incredibly hard to do. It's just the acuity is incredibly high. Okay. Yeah, there are 12 ambulances outside, and we're still waiting to hand over with a 2-hour wait. It's just really dire, and I don't know what else we can do apart from pull patients as much as we can. And I think then once we've pulled as many as we can, it's going to be the waits to be seen, which are also which is going to be another issue, because yeah.
If we lift up, Natalia. There we go. Stop. That's it. Okay, it's good. Relax. Perfect. Can I have the rod holders again?
Now that Luke's spine is secured, Neil can begin to assess the nerve damage.
It's all over the place, isn't it? You can see now we've now aligned the spine. The screws are all on the same level. And this was the last bit.
If the nerves are all severed, it's likely Luke will never walk again.
So I stand corrected, some of his nerve roots are intact. Well, I don't know if they're functional, but they're not, it's not completely gone. Not completely transected. He's got the best chance now that he's aligned.
Some nerves are still intact, which means Luke could make a good recovery.
Okay, time to go.
Hi, is that Louise? Hi, it's Neil Apardia. So Luke's operation's gone well. He's comfortable in recovery. He seems to be doing pretty well, actually. No worries. Okay, take care. Bye. Bye.
All finished.
Lovely. Thank you.
Right, let's take you back then.
Take care, bye-bye. Thank you.
Blythe's injuries mean she'll have to return to see a specialist. But tonight she can go home, once she's had stitches.
Right, you ready to follow me? Yep.
And Becky is on hand to do them.
Right, you've had a bit of an ordeal today.
Yeah, got kicked in the head by my horse.
What's going on up there? I don't know. That noise.
Oh, outside?
Yeah, I can hear some commotion.
Oh, as long as it's not like that drunk idiot.
Oh, I know.
I'm glad he's finally gone, but oh, what a palaver. So unnecessary.
Right, exactly. Unfortunately, that is what we deal with quite frequently.
Do they get combative?
Yeah.
I guess it is like the drink a lot of the time.
Drink and drugs and...
Yeah. Yeah, it's a shame that you guys have to deal with it, though.
Yeah. I reckon one more suture.
Okay.
Keep grabbing the suture. Lovely. All done. How are you feeling?
Yeah, good.
And then you're free to escape.
Amazing,
It was
thank
a pleasure
you
to meet you.
so much.
Despite the circumstances,
Yeah.
I hope you get everything sorted and the third horse doesn't get you.
Yeah. Fingers crossed.
Fingers crossed. All right.
Thank you so much.
And then I'll just show you the way.
Thanks, darling.
Some days are really challenging. It looks chaotic and can be chaotic, but actually you've made it safe and it's controlled. You don't know how you've done it because it's almost like an out-of-body experience. And then you look back at it and you're like, did that actually really happen?
What are we gonna do, buddy?
Not that again.
Not that ever again, please. Yeah, but you're here. So let's just focus on the positives we've done it.
After 3 days in intensive care, Luke is recovering.
Are you able to bring your knee inwards? Try it with a pillow. You comfy? Wiggle. Cool. Are you able to lean to the side and lift a hip at all? Ooh.
Do that one a bit.
Yeah. A little bit.
That was harder.
Okay, that's fine. Well, what we'll do is we'll limit how long you sit out for the first time. If you start feeling uncomfortable, if you start feeling achy or anything like that, just let your nurses know and they can help get you back into bed. All right? Brilliant stuff. All right, that's it for today.
With some nerves still connected and his spine realigned, Luke could regain his mobility.
You don't ever imagine getting a phone call to say your brother's being airlifted to hospital. It's an incredibly overwhelming experience. You feel vulnerable because you can't help. Having to put your trust and faith in medical professionals that you've never met before, although this is their day in and day out, it's terrifying. They were honestly incredible.
I'm a 62-year-old male.
The thing that was the life-threatening thing for you is the overdose.
Listen, I'm Tom, one of the doctors. What happened?
We are very precariously balanced. We need to do something.
All right,
There is a real chance that Paul will die as a result of that.
Are you ready to take on a virtual shift in a busy A&E? Explore the Open University's interactive hospital and learn about the different roles in emergency care. To find it, scan the QR code on screen or go to connect.open.ac.uk/emergency.